Hi, I'm here with my patient who just had abdominal surgery, and I have orders in my computer that I have verified from the physician to go ahead and change the dressing and check out the incision site. So I've gathered my supplies, I'm in my patient's room, and I've done the 2 patient identifiers, I've done the first and last name and the date of birth. So now I'm performing hand hygiene, and I'm putting on a pair of clean gloves. So I'm removing the old dressing. I typically like to use adhesive remover just because it's not as rough on the patient's skin when you're removing all that tape. Alright, and so with this dirty dressing, I'm putting it to the side to dispose of everything in the biohazard container once I'm done. Now I'm looking at the incision site itself, so I want to make sure it hasn't dehisced, and I want to make sure I don't see any signs of infection like any green or creamy discharge, which right now I don't see any, so I think we're good to go. So I'm taking off these dirty gloves now and putting on a pair of clean gloves and performing hand hygiene. Alright, so now with my clean gloves, I'm ready to clean my inside and I am ready to redress it. So first I'm taking some sterile water and I'm pouring it into my little tray that the gauze comes in so I can prepare to clean out my wound. Now that I have all that set up and I've opened my gauze and I've opened everything that I want to use for my incision site, I'm going to take off these gloves and put on some actual sterile gloves. So I'm taking off these gloves and I'm putting on some sterile gloves because we want to make sure this is a sterile procedure because we are dealing with a wound. So I take the soaked gauze that was in the sterile water and I'm cleaning from the inside of the wound out. We don't want to clean from the outside to the inside because that's bringing in bacteria. I want to make sure I'm cleaning in to out. And we're doing both sides. Now, typically in between every one, I would get a new piece of gauze. So I would clean in to out, dump, get a new piece, in to out, get a new piece. Just because that's the most safe way, that is the most way to make sure you're being as sterile as possible when cleaning these incision sites. So then I take a dry piece of gauze. I'm going to pat dry the area, because we don't want to leave the area moist because that leaves room for bacteria to cultivate. Alright, so now that it's all dry, I'm going to get my abdominal binder and I'm going to get some gauze. So now that I have my gauze, I'm going to open that up. I'm going to place it over the wound. Because the doctor ordered that he wanted an abdominal binder on the wound, so your orders typically say from the physician how they would like it dressed, so it's important that you follow those directions. So now that I have my abdominal binder on, I'm going to open another piece for extra security. Alright. And then I'm going to tape this on. So we're going to tape it on to secure it down to the area. Now that the dressing is all on, I'm making sure everything is secure, that all my tape is sealed, and I've got every part of my wound covered. I'm going to take off these gloves and perform hand hygiene and document what I did. So I'm going to document what I found when I looked at the wound. I'm going to document that I redressed it, how I redressed it, so the next nurse knows, okay, this is what I should find when I open up this dressing. And that's it.